Okay, this video is Dr. Mcdougall Quotes Part 1. And these quotes are from my recent book that just came out yesterday, John Mcdougall, The Doctor Who Fought for You, the greatest doctor who ever lived. It's available at Amazon.com. Okay, so let's go through some quotes. Oops, got to get to the right one. Here we go. All right, here we go. Here's somebody who'll say to Dr. Mcdougall, people ask, and this is Dr. Mcdougall talking, people ask, can I ever be healthy again? And I say, starch is the solution of how to become healthy. So basically, for most health problems, the best thing a person could do is start eating a lot of starch. And so that's Dr. Mcdougall's most famous book, his best book, The Starch Solution. And it comes from that situation of being able to say to a patient, the solution to your health problems is eat more starch. And Mcdougall's the one who figured that out and popularized it and solidified its accuracy. Dr. Mcdougall, for the Mcdougall diet, he recommends that people eat 90% of their calories from starch. Okay, that's not a misstatement. 90% of their calories from starch. And there's plenty of populations that have done that. You know, lots of Asians are eating 90% of their calories from white rice. And he said if you only eat white rice, you could potentially get beriberi, but a vitamin deficiency. But you can fix that just by eating a little bit of vegetables and fruits. He recommends people typically eat about 5% of their calories from fruits and 5% of their calories from vegetables. He says all large healthy populations eat a starch-based diet. There are no exceptions. Humans are starchivores. Starch has unlocked the door to health for thousands of my patients. We humans are built to thrive on starch. The more starch we consume, the healthier we become. So what he's basically saying here is the species-specific diet for humans is a starch-based vegan diet. And it's pretty relevant. I mean, if you go to the zookeeper will know what diet their animal is supposed to eat. Whatever animal they take care of. You know, lions and tigers and bears and chimps. That zookeeper will know. There'll be a commissary who designs a diet based on research to make sure it matches their natural environment. And what I'm saying is it's ridiculous that doctors and other healthcare providers don't know what humans are supposed to eat. It's a very important thing. I can also tell you I've been a pretty serious student of science ever since I was 18 years old. And the most important thing I ever learned in over 40 years of studying health is that humans should eat a starch-based diet. It's the most important thing you could know about health. It's far more important than exercise. Exercise is very good for you, but you can't outrun a bad diet. Okay, Dr. Mcdougall continues. Starches include rice, corn, potatoes, sweet potatoes, beans, peas, barley, millet, oats, quinoa. I always like to say quinoa, but everyone reminds me quinoa, rice, sorghum, wheat, squash. Okay, he says if a person only ate white rice, okay, they could get beriberi, but okay, we talked about that. If you take just one message from this book, from Starch Solution book, it would be eat more starch. I am the luckiest doctor in the world because my patients get well. And that's a very unique statement. People think that's like a no big deal statement. No, it's a big deal. What he's saying here is that if you treat the common diseases, the gateway diseases, obesity, diabetes, and hypertension, which most Americans have after age 50, if you treat those with pills, as is the standard of care in conventional medicine, you have a 0% cure rate. It's a joke, a 0% cure rate. What kind of a sports team would say, we're the best, we never win a game? And that's what conventional medicine does. It never cures these diseases, ever. Okay, whereas the low-fat vegan diet, starch-based vegan diet with no oils, it cures those diseases almost always. Most of the time. If a person's had the disease 20, 30 or more years, there's going to be some tissue damage. You know, the arteries are going to be all calcified and whatnot, and it might be hard to fully reverse the hypertension or the diabetes once you've lost insulin production in the pancreas beta islet cells. However, if you get to them soon enough, you can very routinely cure these diseases 100%. And the disease is cured because the patient doesn't need to take any medicine. They need to maintain a healthy diet, but they should be doing that anyways. And that's essentially free because they have to eat anyways. And starch is cheap and it stores well. It's a great food. The best food, and it's also cheap and it stores well. And in a sense, that reminds me of God's way of healing, okay? Free and available to everybody, not some fancy stuff. Okay, let's get back to Dr. Mcdougall quotes. He says, the fat you eat is the fat you wear. The higher the percentage of calories from fat in the diet, the fatter the population, okay? And you look at that, look at the Western world. The part of the population, the higher the fat they eat, the more fat they get, okay? The diet of the SAD, Standard American Diet, is much higher in fat than these, blue zone diets and all these, rice-based diets, sweet potato-based diets, regular potato-based diets like in Peru, sweet potato-based diet like old Okinawa, like Papua New Guinea, for example, the white rice diets like a lot of these Asian countries, China, Japan, Korea. Okay, Dr. McDougall continues. Fat is the major toxin in the Western diet. That's an important statement. Fat is the major toxin in the Western diet. I say that and I emphasize that because so many BS artists on the internet are trying to tell you, oh, you need to get your good fats. Yeah, right. Fat is the major toxin in the Western diet. Fat paralyzes the insulin receptor and causes obesity. So we know that the more fat you eat, the fatter you get, and obesity is bad. It's associated with hypertension and diabetes. We know that fat itself paralyzes the insulin receptor. In a sense, it inhibits the intermitochondrial membrane and thus inhibits electron transport and thus inhibits energy production, and the cell senses that as overnutrition, and it has the effect of blocking the glucose uptake into the cell. Okay, Dr. McDougall continues. This is about fat causing diabetes, causing insulin resistance. He says it's important for patients to realize that fat causes diabetes. How can a patient get better if they don't know that? If they don't know that, then they don't know what they should do. The key to resolving diabetes, and then later he also says acne, is to minimize dietary fat. And that's an important statement. So here's Dr. McDougall, this little, Irish guy from Podunk, okay? He really has no status in the medical world. And he gets up on his soapbox and he says, diabetes is caused by high-fat diet, and diabetics should not eat any fat. Meanwhile, the American Diabetes Foundations, associations, are recommending high-fat diets, okay? And if you go to endocrinologists, fellowship-trained specialists in diabetes from conventional medicine, very common, they'll put patients on diets with a lot of fat and tell them to count their carbs. Stupid. Counterproductive, okay? The standard of care is to mismanage the patient so they never get better. That's what Pritikin said. He said the American Diabetes Association diet is designed to make sure the patient never gets better. Pritikin even would joke that he would say, what percentage of Americans are diabetic? And then he would say, they all are. And what was he getting at? He was getting at that. He said they're all diabetic if you do an oral glucose tolerance test after dinner, because they almost all of them eat high-fat dinners. Okay, Dr. McDougall continues. Fat causes red blood cells to stick together, which is called blood sludge. Okay, he's got a good movie on his YouTube channel about blood sludge after a high-fat meal. It's only about 50 seconds long. It's well worth watching because once you see that, you'll get it. You'll remember why you felt sluggish now after you went to a greasy spoon when you were younger. Okay, so he says, it sticks the red blood cells together into what is called blood sludge. Blood sludge is the main cause of hypertension. Okay, that's a big deal because millions of people die every year from complications of hypertension. It's the number one association with atherosclerosis, which is the number one association with coronary artery disease, which is the number one association with stroke. Now, you can also look at it a slightly different way. High cholesterol is the number one association with atherosclerosis based on it being a bridging molecule sticking red blood cells together. Okay, but hypertension damages the arteries, and some people say you got to have hypertension-induced injury first and a loss of the Wing-Kessel effect in the ascending thoracic aorta, meaning that the ascending thoracic aorta is overstretched chronically such that it loses its elastic fibers and thus can no longer generate elastic recoil during diastole, the relaxation phase of the heart, such that the person can't generate much diastolic flow. And if they can't generate much diastolic flow, then that means they have to increase systolic flow. They have to increase systolic blood pressure, the contractile phase of the heart. And that leads to left ventricular hypertrophy. That leads to less diastolic filling of the coronaries. That can down the road lead to cardiac ischemia, which can down the road lead to congestive heart failure. Basically, when you eat the high-fat diet, you get everything going in the bad direction, pushing yourself towards vicious cycles of tissue destruction in your heart, for example. And you could end up with congestive heart failure after decades of that. Okay, Dr. McDougall continues. High-fat meal decreases PaO2, pressure arterial of oxygen, by about 20%. And that's based on the work largely of Peter Quo and of Roy Swank. Okay, Roy Swank even said that he had measured one time like a 35% drop in brain blood flow in hamsters after a high-fat meal. Peter Quo was a cardiologist in Pennsylvania in the 1950s who did studies about feeding high-fat meals to cardiac angina patients, and then checking their blood lipids every 30 minutes to see when they would become symptomatic, and they would routinely become symptomatic at peak lipemia, highest blood levels of fats, because the fats were causing blood sludge, dropping the delivery of oxygen to tissue. This is a big deal to know, because if you avoid that, you get 20% more pressure oxygen in your blood, and you're less likely to have problems, especially somebody who's compromised, like an old smoker with COPD, chronic obstructive pulmonary disease, or an asthmatic in an acute episode, etc. Anyways, Dr. Mcdougall continues, blood sludge lowers oxygen delivery to the tissues. Oils are even worse than saturated fat for causing blood sludge. And that's based on the work of Meyer Friedman and Ray Rosenman. They were two ophthalmologists who built on the work originally of Peter Quo, and they would feed the patients high-fat meals, and then they would look at their eyes with an 80 times microscope, and they could see the capillaries occluding from the high-fat meal, the blood sludge effect. So anyways, I'm just going to do one page of quotes at a time. That's the end of this first part one of Dr. Mcdougall quotes. Hope that was helpful.